a webinar that's being, yes, so we have a capacity building webinar that's being hosted by Lake Health and Wellbeing. We are a public health NGO based in St. Kitts. And we're happy to have you guys. Thank you for joining us this morning. You know, Saturday can be a busy day for folks. So we really appreciate you being here. Today we have the third part in a 3-part series where we've been hosting workshops, one each month since the month of June. And today we have a monitoring and evaluation session, which will be facilitated by Dr. Shelly Trim, who is a very experienced monitoring and evaluation specialist. She'll tell you a little bit about herself and her experience once she takes the microphone. So I just wanted to welcome everybody. My name is Iseline. I'm the Senior Advocacy Officer at Lake Health and Wellbeing. So thank you all for being here. And I am going to turn over to Shelly, who's going to facilitate the session and provide us with all the information we need. Just a note, if you want to interact, feel free to drop a note in the chat and let us know where you're from and say hi and good morning to everyone. We're looking forward to having a very informative and engaging and interactive session today. So thank you all, and over to you, Shelly, so we can get started. Thank you.
All right. Hello, good morning, everyone. Open your mics, please.
Good morning.
Good morning.
Good morning.
Novia.
Good morning, everyone.
Good morning,
Good
everyone.
morning.
Good morning. Good morning.
Good morning.
From Grenada.
Yay, great. Yeah, tell us where you're from too. Well, we'll talk a little bit about that, but I wanted to make sure, yes, it's Saturday morning, it is mid-August. Most of us have started sweating already, but I wanted to say hello, good morning, and I'll tell you a little bit about myself. My slides are working, yes. Okay, some things about me. I'm Jamaican born. I grew up in the United States, but I ended up coming back, and I've been living back in Jamaica for the last 10 years. I have a master's in public health degree in international health and maternal child health. I also have a doctorate in public health, focusing on family and reproductive health. I work with several nonprofit organizations in the US, here in the Caribbean region, and I currently support the UN in Jamaica. So let's talk about the objectives of this session today. So I really want to help you understand the difference between monitoring and evaluation, identify the elements and steps of developing an M&E plan, explain how to create an M&E plan for your upcoming program, as well as describe how to advocate for the creation and use of M&E plans for your program and organization. Now, I just wanted to know if you can raise your hand, and if either Elizabeth or Novia can help me. I also wanted to see if we can show both Elizabeth and Novia. These are my co-presenters. They have been part of the sessions today, the sessions previously. Elizabeth started this wonderful series talking about grant writing and grant development. And Novia, we can see, yeah, great. Novia is a project focused on project management, and she's a project management expert. And thank you so much for participating today, guys. You guys gave me a very nice way to move forward. So I hope you've been part of the sessions. Has anyone been part of the previous sessions? Just go ahead, and if you see anything in the chat, anyone been part of the previous sessions? Anything in the chat, Elizabeth?
No responses in the chat thus far.
No responses. Okay, so if that's a no, I just also wanted to let you know that this presentation really looked at some of the questions that were discussed during the first 2 presentations, really focusing on how to develop the M&E plan. And I hope to help you feel a little bit better about approaching and developing and being part of this process as you move forward. So I asked, I just also wanted to know, if you haven't been part of the session before, how do you have an interest in M&E? Excuse me. Sorry. What's your interest in monitoring and evaluation? No?
Hello,
No.
good morning.
Hello, good morning.
Yes, I'm Elliot Hippolyte. And I actually saw this workshop on Facebook, and I do have an interest in monitoring and evaluation since it kind of can help with project management.
Mhm.
That's basically it.
Thank you. And where are you calling from? Where are you?
I
coming
am
in
from Dominica, but I live in St. Lucia.
Ah, excellent. Beautiful, both
Yes.
countries.
Yes.
Thank you so much. And all of us, Elizabeth and Novia and I, are sometimes maybe overly enthusiastic about monitoring and evaluation. Maybe you'll become as enthusiastic during the course of the presentation or afterwards. All right, let's move next.
Shelly, I see Lindell Archibald has a hand up.
Oh, yes, go ahead.
Hi, good morning. I'm Lindell Archibald and I'm from St. Lucia. I signed up for the project management webinar, but I totally forgot about it, so I never attended. So I made it my duty to put this one in my calendar with a couple reminders so that I wouldn't forget. But to your question, I've been working as a program coordinator in project management over the last few years, maybe 5 to 10 years. And monitoring evaluation is a very key part of any program that you implement. And I figured that your seminar about actually developing a plan would be a great way to get some insight. I have some insight into it already, but I just thought it would be good to be part of this and to learn about actually developing a plan, because you often have M&E persons come in to do that aspect, and it would be good to just have that ability under my belt. So I thought it necessary to sign up for your webinar this morning. So I'm looking forward to being here for the next hour and a half.
Oh, great. Thank you so much. And just to let you know, we also have our project management specialist, Novia McKay, also on the call today. So if you have any other questions, I'm going to invite her to provide any comments as we move forward if you have any other questions related to project management. And this is all related. M&E, of course, is project management.
Absolutely. It is. It is a very important aspect of the whole project management process. So thank you for that. Appreciate it.
So Cynthia Polius Prescott, Shelly has her hand up.
Cynthia, go ahead.
Good morning, everyone.
Good morning.
I hope you're doing well. Cynthia Polius Prescott from St. Lucia.
Morning, Dr.
Yes, I attended the last webinar.
Okay.
It's really a pleasure to be part of this one on monitoring and evaluation. I have been working on a projects and programs. I was really encouraged to hear that Mrs. Archibald is here. I worked with Mrs. Archibald on the Sky project that I told you about at the last webinar. Monitoring evaluation is a critical part of any project. And I have some skills in monitoring evaluation, but I think that this session today will really provide more insights. And I really look forward to our discussion.
I hope so too. I hope so too. Hopefully it will be useful for you today. And thank you for joining. And actually, for persons who haven't responded, we have a quick poll we'll be doing in a few minutes to talk about your actual experience in M&E. Let me just move forward.
Shelly, Donna St. Mark is also on the webinar.
Donna, would you like to say anything?
Yes, just briefly. Hi, my name is Donna Senmark and I'm from St. Lucia. I actually came across this webinar on Facebook. I'm currently completing my bachelor's in social work and youth development work, and this seemed to be a very critical aspect. So it was for my professional development, just to learn a little more. I decided to join.
Oh, great. Thank you so much. Thank you so much. Actually, I know I actually have also known other persons who have started off. I mean, as you saw, my first focus actually has always been international health and health work. And I sort of came into monitoring and evaluation, especially during my doctoral program. And since my degree really was focused on active implementation, active management and understanding and support to projects, you know, M&E became obviously one of my main interests at that time. And I've known persons who've worked in evaluation for a long time and even logic model their life. And actually, it actually works. So I'm glad you joined, and I hope this session is useful for you today. Is there anyone else, Elizabeth? So I can move forward?
I don't see anyone else.
All right.
I mean,
great.
there's lots on the call,
Lots
just
online.
no one's wanting to introduce.
Okay, we'll give them another opportunity soon. All right, so next. Liz.
Okay, so why is monitoring, what is monitoring and what is evaluation, and why are they important? And I think some of the those of you who've introduced yourselves already kind of talked about that a little bit, but anyone else have any thoughts on what is monitoring and what is evaluation, and why are the two important to your work?
Come on, people, you just say you've been in monitoring and evaluation before. Come on, man.
Come on, everyone. No, don't be shy.
Don't be shy. What is monitoring? I mean, half of you said that you've worked in projects and project management. Why is monitoring important? Just one person.
So you can have a sense of how your program, how your project is doing, how it's progressing. And if things are not going well, then if you monitor it, then you have the ability to make some changes before it's too late. So it gives you a good insight into what you're doing, basically, and gives you an opportunity to make necessary changes along the way.
Exactly. And what about evaluation? No one has been part of an evaluation. No one has had a project evaluated. Why is evaluation important?
Evaluation just helps you I understand whether your project has had the impact that you had intended, and really to just understand, you know, are you reaching your beneficiaries? Are you meeting your objectives and those types of things?
Exactly, that's correct. And when we look a little bit more on what's the difference between monitoring and evaluation? Monitoring, of course, is the continuous process. It refers to an organized process of overseeing and checking the activities undertaken by a project to ascertain whether it's capable of achieving the planned results. Like I said, monitoring is a continuous activity based on early detailed information on the progress or the delay of ongoing activities. Now, evaluation tends to be a scientific process, or it's defined as a scientific process that gauges the success of a project or program in meeting its overall objectives. And evaluation really is an examination concerning its relevance, its effectiveness, its efficiency, and the impact of activities in the light of the specific objectives. Now, a monitoring and evaluation enables your understanding of what factors and approaches lead to that change. It helps to improve your overall strategies. And like someone had said before, helps to make some course corrections during the process, during implementation. And it helps you to be accountable. This is the accountability component of for your donors and for your internal and external stakeholders. It's part of helping to justify why you received those funds and why you actually have staff and why this continues to be important. So overall, ongoing monitoring and use of real-time information is important, as sometimes even political opportunities, especially those related to advocacy campaigns, can change quickly, requiring course correction or revising your strategy. And this helps you, this framework or this plan actually allows you to help pinpoint exactly what may need to be changed and what you're achieving or not achieving. So the next we have the first poll. Yes, and if everyone can help respond, have you ever been responsible for monitoring our project? I mean, literally monitoring, having a monitoring plan, monitoring. So if you can go ahead and submit your response, we can just have a good sense of also who's here on the team and who can help support my presentation today with your examples. I've only seen one person respond.
11 people have responded so far. So 11 of the 16. So
Oh, 11 of the 16. Oh,
yeah.
okay. So give me one more minute and then you can post the responses over.
Okay, sure.
Okay, let's show. Okay, so we have a 50-50 split. Okay, that's not bad. I'm really happy to see that a lot of you, 50% of you, have been responsible for monitoring a project, and you can actually provide some insights into today's session. Thank you so much. Like I said, so you've got the grant, you have a project manager, what's next? So in previous presentations, we had talked about the project life cycle. Projects have a typical flow or of a life cycle in which a general methodology is applied and repeated. And at the center of all of the steps and the project life cycle really is monitoring and reporting. And in this cycle, and individual steps can be complex for a program, or it can have many subsections for an individual objective within a project. But monitoring and reporting is a central component of a project life cycle. Actually, I'm not even seeing the rest of the, there we go. So as we said, you have the initiation, you have the planning, the execution, closing and handover, and at the center of the piece always is monitoring and evaluation. And as you have a team, project monitoring reviews the work plan and any stakeholder feedback. We talked before about if you redo a needs assessment at the actual implementation of your project, meaning that you may have had an assessment or information about to help you develop your project proposal. Excuse me. But now that you have that on, you might do another assessment just to make sure that your objectives, your risks, your assumption still hold true after you've received the grant. So you review your work plan and any stakeholder feedback, review the last findings of the assessment. If you have the opportunity and the money, basically you need to identify, recruit a monitoring officer, and you can review those assessment findings. So an anemone plan should be developed at the beginning of the program, ideally when the interventions are being designed. I'm sure in project or grant proposals that they ask you to put some information in on how you will know you have achieved the project goal. So even if you don't have also the funds to actually hire a separate project monitoring officer, the responsibility still should be assigned to someone. Usually it's the project manager, since they understand the project goals and the objectives the most. I would have to say characteristics of a good monitoring officer are that they're detail-oriented, can understand the logic model and the theory of change, are familiar with data collection methodologies, and you find them to be honest and can be unbiased. And that's really, really important. When we looked at the effective project monitoring highlights, as mentioned before, review this needs assessment, identify again who's your beneficiaries, direct and indirect within your project, and identify again the project risks. As I said, you're going to develop, or you probably have already developed, a logic model, which clarifies the outcomes of your projects and your plan to achieve the desired outcomes. And it's essential to identify the inputs needed to start towards that achievement. And it really basically is a glance, the project at a glance. And that's why a logic model is good and useful. Yeah, I'll move on to that. So you're going to develop an M&E plan. You develop the monitoring plan, consider the costs related to data collection. And this is something I really have seen stressed as sometimes the Achilles heel for projects, is that they may have a monitoring plan, but they don't necessarily consider the cost implications based on that scope of work. You can always have, of course, activities that build on what was done at the start, or use in-house techniques like interviews or focus groups to validate your assumptions and findings of your objectives. Stakeholder analysis can also be included in the scope of your assessment, but it also helps to identify the various needs and expectations of what needs to be considered. And that's important as well as you start even thinking about reporting and dissemination. So you use your monitoring plan to elaborate a detailed reporting schedule, and you should include the creation of a dissemination plan and its costs. Excuse me. And these are really one of the most important components of monitoring. And I'm just going to also show you. So you have gone from here. This is what eventually you want your monitoring evaluation plan or your framework to look like at the end. You can see that we have indicators. You have the definition of the indicators. Sometimes that's included in the plan. A baseline, a target, excuse me, a data source, or also called the means of verification. Frequency, how often will this measurement be measured over the course of the project? It's also considered, sometimes it's also called timing. Defining who is responsible for its management and reporting. So a good M&E plan really has these components included in it. Shelly, can you put up the second poll, please? So since we know most of you, at least half of you, have had experience in monitoring a project, just wanted to know, what do you think is the hardest part of developing a monitoring plan? Determining what to measure, determining the data collection methodology, developing indicators or selecting indicators, determining the frequency of data collection, or costing the monitoring activities, or all of it. As all of it is a big challenge. Please go ahead and vote. Let me know if we have a good set of responses.
Yeah. So far, 8 people have completed, 8 out of 16.
Okay. We're gonna do it, trying to get a little bit more to a standard 70% of a good poll.
We're at 11.
We're at 11. Okay, great. Let's show the response.
Okay.
Okay, so 8% says determining what to measure. 17 reported determining data collection methodology. Developing indicators also is very difficult. No one said determining the frequency, which is good. Costing monitoring activities, and 25% said all of the above. Okay, I'm hoping to make that a little bit easier today. But I have to say there's also a lot more that we can say about each of these components in terms of determining the methodology or developing or selecting indicators, costing, as well as determining what to measure. Excuse me. So here we go. So what are the components of an M&E plan? As I mentioned before, you would review your project proposal and your logic model, hopefully that you developed during your proposal development stage. Define your indicators. If they can be both process and outcome indicators. You will need a mix of both. Define your data collection methods, as well as the timeline or the frequency of data collection. You identify your monitoring and evaluation roles and responsibility, which can be a number of persons on your staff, and that would also be included in your M&E plan. You create an analysis plan and reporting templates. Always good to put this as you start developing the project. Sometimes people wait until the end and say, okay, oh, what do we need to report on? Let me go back and ask what the donors wanted. Okay, what do our other stakeholders want? What do we need to make sure that we are on target of what we're doing? But creating this plan, analysis plan, and having reporting templates, even if you're doing after you develop your M&E plan, it would really save you a lot of time and frustration. Included in developing an M&E plan, I also like to include a plan for dissemination and donor reporting. As mentioned before, this can be included in your actual M&E framework, or if you have something else that's just a plan for dissemination, that is really important as well, because remember, this information is not just for you. This is for your external stakeholders, it's for your donors. And this is the time when you have an understanding of maybe, as I look back at the plan or I'm actually reporting, there might be some bottlenecks that I have to address. And then also I like to include to help to determine the budget of data collection activities. And we can talk about that again. Next, we're looking at the logic model. Now, this is just a very brief overview of a logic model or theory of change. And it's a graphical representation or a roadmap of your project. It identifies the resources that you expect to need for the project, and those are considered the inputs. It details the activities of what you plan. We like to say, some people say meat potatoes. I like to say it's the Ackee saltfish of your program. It really is what it's about. It identifies what those activities will produce in terms of outputs, and it is one way to measure your achievement. But this isn't the only way. Next we can talk about outcomes. Those are specifically in the short and long term that you expect to see changes in terms of a measurable changes in your project. It's a good idea to include a statement of assumptions and the context. Assumptions really are the beliefs we have about the program or intervention and the resources involved. Assumptions include the way we think about how we think the program will work. Contextual factors describe the environment, especially in which the program exists, and external factors that interact or may influence the program or intervention. Contextual factors also are the conditions over which you have little or no control that may affect your success. But it's important to document some of those contextual factors so that when you have to ask, or when you're asked or reporting what impeded 100% of project implementation, you will be able to identify those quickly. And remember, the logic model is based on your goals and objectives that you've already outlined for the project. Being able to connect them, the objectives of the project, along with your outputs and your outcomes. This is why this is sort of the visual roadmap of your program. It provides you also some guidance on how you might collect data to depict the outputs and demonstrate your outcomes. And as you can see, you have the arrows moving to right to left. And we talked about it in the last session about developing a logic model. And when you're thinking about it in the M&E framework mind, you think about what outcomes you want to see, what kinds of outputs will you need to help to support that changes. Then you go look back at then what activities would contribute to those outputs. And then finally, what inputs like funding sources or expertise that would need to influence your activities. So when you think about the outcome first, it sort of helps you to reline up what components you need to make sure you achieve those outcomes. Excuse me. So let's look at back again at those components of an M&E plan. So like I said, the first step is to create an M&E plan to identify the program goals and objectives. And if your program already has that logic model of theory of change, then the program goals are most likely already defined, right? However, if not, the plan is a great place to start to identify the program goals and objective more concisely. A theory of change is sort of the new language, I guess, for the last maybe 3-4 years really has been in versus a logic model. A theory of change is basically just describing how you expect that change to happen. And it can be a series of if-then statements. So if this occurs, if X occurs, then we expect this type of change. And if this type of change occurs, then this can be achieved. So the theory of change could be a session unto itself, but it really helps you to understand your expectation of change. Some of what you may originally think about how you're going to achieve your outcome really might change or differ when you look at this theory of change and say, okay, is that a really good assumption? Are we assuming that the government is going to change their policy in this particular area? And the assumptions that we make about those changes can really help to, in the future, identify those areas of bottlenecks or new activities that may have to happen to reach that overall outcome. As part of this first step, again, you define your program goals, starting with really answering these first 3 questions. What problem is the program trying to solve? What steps are being taken to solve that problem? How will program staff know when the program has been successful in solving the problem? And sometimes when even in small island development states, there might be, of course, other organizations that are trying to solve the same problem. It's good to know who they are and what exactly they're doing to show that, to help support how your particular project has fared within the overall intervention and reaching your overall outcomes, and what other influences might be happening at the same time that can impact your intervention. So here's an example. Helping to answer these questions will help to identify what the program is expected to do. For example, if you have a program starting a condom distribution program for adolescents, you might look at, this is your overall program statement, high rates of unintended pregnancy and sexual transmitted infections among youth. The solution, that this is what your intervention would be, is to promote and distribute free condoms in the community at youth-friendly locations. And a measure of success is to show lower rates of unintended pregnancy and STI transmission among youth. higher or a higher percentage of condom use among sexually active youth. When you start looking at about how you're going to measure your success, it should start you thinking about, how will I measure the lowered rates of unintended pregnancy? Where will I get that information from? How often should I do it? This program, our intervention is for 2 years. When would be the best times to measure that and see how well it's progressing? And as well as the percentage of condom use among sexually active youth. How will I know that? What kinds of data collection methodology will I need to measure that? So in addition, it's also important to develop what we call intermediate outputs or objectives for the program to help track successful steps towards the overall program goal. The second part of a monitoring framework is to help define your objectives. After you define your objectives, what are you trying to achieve at the end? Should be specific, measurable, achievable, realistic, and time-bound. For example, the government increases taxes on sweetened beverages by 20% by 2023. That might look familiar to some people. And define, like I said, the long, intermediate, and short-term outcomes. Long-term changes really existing, long-term meaning the changes in existing policies, development of new policies. Excuse me. An intermediate change or outcome can be changes in knowledge, behavior, and attitudes. Or a medium and a short-term change can really looking at the progress of changes like the establishment of coalitions or the establishment of networks to help reach your overall objective. Thinking about which one is long and intermediate and short really can help you as you develop your M&E framework, because then it will impact the type of indicators that you will have connected to determine those long, intermediate, and short-term outcomes. So let's look at indicators. Indicators. Some people say, oh, I hate thinking about developing indicators. How do I select them? How to define them? Where do I find them? Do I just use others? Well, indicators overall are defined. It's a way of tracking progress towards achieving those goals. As mentioned before, we have both process indicators and outcome indicators. Program indicators really should be a mix of those that measure both process and what is being done in the program, and those that measure the outcomes. When you define an indicator, make sure you determine your baseline for the indicator and target. And not all baselines need to start at 0, but you need to do your own research and for any recent programs that may have had similar interventions in your context. And not all targets have to be huge, 100% achievement of something, but really should reflect what you propose in your project proposal and are most importantly realistic. Say, for example, one of your process indicators are number of trainings held with healthcare providers, number of outreach activities conducted. First, guys, you have your plan, you're moving forward. You say you're going to do 25 trainings with healthcare providers, or 10 trainings with healthcare providers, and have an overall 100 healthcare providers of all different levels participate in the training. But that day that you're holding the trainings there might have been an extreme weather incident. There's a hurricane, or there's rain, or there's flooding that has now impacted the number of persons or healthcare providers that attend your training. So if you had the number of training sessions to be 10, but as you go through the process, you'll see that even though you plan for 10, you might maybe want your indicator to be a little bit, I would say, I tend to be more hesitant in developing process indicators. Even though I'm pretty sure I can reach 10 trainings, I might put 8 trainings, because of any kind of incidents. You can still have 10 as your target. And 8 out of 10 isn't bad. It's 80% of your trainings. Ideally, you want to reach at least 70 to 75% of your targets, and keep that in mind when you're thinking about how you are defining your targets. So you never usually try to say 100% of your trainings will happen or 100% of your healthcare providers will participate. Anything can happen. I would say be realistic and be a bit conservative. Even though you think you'll reach, there's very likely you'll reach 100% of your participants because you actually are focusing on getting 150. Be conservative and say the 100 instead of the 150. Does that make sense to persons? Elizabeth or Nova, did you want to add anything here?
No, the only thing I would say is that, especially depending on the size or the complexity of your program, you want to try and one, look and see when you're developing your indicators, if there are existing frameworks like international or even national level frameworks that have indicators that already have been drafted or exist that your work is relevant to or can be connected to. Because then one, that helps with the framing of your work. You don't have to come up with indicators all on your own. And two, it helps for future purposes. You're able to link the work and the achievements of your program to other, whether it is national or international frameworks. The other thing is that you want to try and keep it simple rather than complex, and be very laser focused on having, better to have fewer high quality indicators that you can measure and track against than to have many indicators, and then at the end of the day your program wasn't designed to capture them, or your M&E exercises found it difficult to actually measure them. So I would say look at what is available and already in the space that is relevant to your work, and where possible keep your indicators fewer but more targeted at the outcomes.
That's great advice, Novia. Thank you. And
yeah, I agree
okay,
as
yeah.
well. I just wanted to say that using existing indicators, make sure that what you've chosen is credible. So it doesn't look as if you created indicators that have no relevance, or it's just not credible in the work.
Yeah, that's actually great advice, Elizabeth. A lot of times persons think that they have to develop indicators themselves. Okay, what should I choose? But there are a lot of indicators that are out there. Do some research. Anything that's trying to look for other programs, very similar programs and contexts that may be having similar interventions, and look for the evaluations in your research to see what types of indicators they have used. You can use those again, and especially if they've been used before and been used successfully, and actually have a definition of how they were measured and used in that context. So it's not necessarily creating new indicators all the time, but look for what else is out there. Also, rule of thumb for process indicators, just remember all indicators, like I said, even as we look back first at the objectives, we're going to look at larger indicators. So stay away from necessarily from activity-based indicators, meaning that your overall objective, again, was, excuse me, from the first example, was to help lower the STI rates among youth. So you're going to have a lot of different things that you've already defined in your logic model for activities of helping to reach that overall objective of helping to lower the STI rates. So some things going to help you to keep your project on track, including your condom outreach sessions, your trainings, your distribution, those things, but that's going to be part of your overall objective. not necessarily, okay, we want one indicator for training, one indicator for activities, one for this. As long as they focus back on the overall objective that you're trying to reach, those are the best ones to use. So it may take maybe 3 to 4 indicators per objective, but again, depends on how long the intervention is and the depth of your objective. Overall, for outcome indicators, those really help track your program activities or your overall project objectives, and to see how successful you have been. Have you been making a difference? Also, rule of thumb, process indicators usually come in the form of number of, and outcome indicators, we like to use a higher level indicator, which we think about as proportion. But when you use proportions or percentages, you have to ensure that you know what your denominator is. Sometimes that really messes people up. People trying to understand, okay, who should be the denominator? Should we say all children 15 to 19? We can't necessarily survey all of those children that are 15 to 19. Maybe we should do 15 to 19 within our project area. Okay, do we have census data to understand how many we're going to impact, census data of how many persons living in your area or the intervention area that are 15 to 19. That can be your denominator, but it has to be as recent as possible as well. So there's always some issues about choosing or selecting your indicators, but it's possible, and it's just making sure that you have a full conversation with your staff, your program director, as you develop the M&E plan. When you think about percentages, people always like to use percentages, but they sometimes forget that they need the denominator, and the denominator really needs to match and be available to what you have defined. Yes. The third component of an M&E plan really is helping to define your data collection methods and timeline. So after you've created your indicator, again, it's time to decide what methods you're going to use for gathering that data and how often that data will be recorded to track the indicators. Now, this is important because you need to figure out, okay, if I want to know the number of youth 15 to 19 that are using condoms or using condoms at first intercourse, how are you going to collect that information? What would be your source of your data? And will you need more than one source of data or means of verification to help answer those programming questions? And data collection methodology really should be a conversation between your program staff and your stakeholders and maybe even your donors. So here's a big example. So we want to look at reach and success of your program interventions in a particular audience. Again, small surveys with that audience, such as provider interviews or client interviews might be necessary. You're looking at the reach of your media interventions. You want to look at your data source, maybe then your media ratings data, your broadcaster logs, using Google Analytics for your website. If your website is one of the areas that you have put in place as part of your intervention to get information. And when you're using qualitative data, meaning that you're actually not looking at numeric responses, but you're actually doing selecting a methodology to gain more information from particular persons, either key stakeholders or part of the intervention participants themselves. You can use focus groups, in-depth interviews. If you're working with a particular, say in this example, youth, looking at diaries or actually doing case studies. And as I mentioned before, it's important to include the data collection methodology and data source as you develop the M&E plan, because you have to have a budget for data collections. Surveys, even short ones, may have budget implications. And when you decide to do a survey, for example, okay, is this going to be paper-based, or are we going to be able to put it on tablets? How many do we need interviewers or data collectors? How many do you think we need for the number of persons we want to collect information from? Do the data collectors need to go out into the field? Who's going to take them there? Is there a vehicle? Are you going to ask persons to, you're going to pay for persons' gas to actually go out into the field? If you're doing surveys in person, are you going to have an incentive or something small to help support persons to, or encourage persons to participate in your survey? All those have budget implications. So when you look at your data source and you're looking at your data collection methodology, also consider the budget, because you may decide, yes, surveys is where we want to go, definitely. But the cost may impede how many persons you actually can interview. The same thing for qualitative data collection. You think focus groups have implications for the budget related to where is it going to be done? Can you get a venue for free that's private and has the numbers of tables and chairs you're going to need to do the interviews? You're going to need maybe someone with to help write some notes during the course of that session, that focus group session. Are you going to have beverages or refreshments depending on the length of the focus group? Even with in-depth interviews, you may decide that, okay, we're going to do in-depth interviews online, just do a Zoom call. What about connectivity issues for the persons that you're interviewing? What are some other options? Are you going to do telephone interviews? How much are those going to cost? So just considering, just as I was saying, that you look at the budget as you select your data collection methodology. And just a tip from previous experience. So I've done data collection for very large surveys. I did a very large survey, supported a survey when I was working in Ghana at a research center, looking at reproductive health issues. And I had over 30 data collectors plus 3 data managers. And I would go out in the field every week. Sometimes I would just randomly choose where to go, making sure that not only people are in the field are doing what they're supposed to be doing, but sometimes there might be issues in terms of data collection with participants that may need to be resolved. So train your data collectors well if you do have data collectors, and if you're depending them to go out into the field alone, consider what the costs are and what kinds of issues can come out in the field. You have to make sure that there's all these different components, even in terms of how to select and train your data collectors, but we can talk about that at any time. I just wanted to know if anybody has any questions here on this. Any hands?
Yes, I have a question.
Yes, sir.
Hello, yes. With respect to the data collection, would you need a specialist to interpret the data?
Excuse me?
With respect to the data collection, would you need a data specialist to interpret the data?
Sometimes you might need someone to help with data analysis. Depends on the type of data collection that you're doing. So if you're having, say, surveys, and you have surveys with maybe over 100 persons or a large set of data collection, you might need someone to help you decide who's that sample. If you have sample information, who should be selected, especially if it's a population-based survey, who should be selected for that survey. After you've collected that information, you want to see, you're really on track, your intervention said you're going to make a difference between the persons who received the intervention versus persons who didn't receive the intervention. You might need a data analyst and to make sure that how you look at that data and analyze it separately and want to have any kind of statistical reference to the differences between the groups that you find. You might need a data analyst to help you with that. I have seen support come from the University of West Indies. Actually has sometimes a good set of researchers that can help guide in and act as a data analyst role. But when you also think about the data source or your data collection method, you also have to think about that data analysis plan. And we're gonna talk about that a little bit later. But yes, sometimes you might need a data analyst, or if your project director or your project manager has experience in that, that they might be the ones to act like that as well, as long as maybe there's someone else that they can ask questions and help to support their thinking and their analysis. And as I mentioned that, I should also say one of the other implications for data collection is also thinking about how you're going to collect that data and how you're going to analyze it. If you have comparison groups, do you have what kind of what do you call it? Data management programs? Are you using Stata? Are you using SPSS? You need some statistical software. Do you already have it in house? Can you get it from somewhere else cheaper with relatively ease of cost? Those might have implications, as well as I've used Excel for help with the data collection. So inputting that information, who's going to input that data if you do a face-to-face survey? You might ask someone to do it. You might need to hire someone to do it. So that has implications on your data source as well. Move to the next slide. I hope I was able to respond to your question.
Yes, thank you very much.
All right, no problem. So next is the components of an M&E plan, defining your data collection methods and your timeline. Like I said, it's also necessary to decide how often it will be collected. And that really, I'm really focusing on the timeline here. And this will be affected, or even you might have to work backward by what's your donor requirements. You know, the donor says, okay, we need mid-year reports and end-of-year reports. Now count backward, where you give yourself sufficient time to collect that data and to analyze that data sufficiently. Let's look at an example. So as we move toward furthering this framework, we have our indicator number of trainings held with healthcare providers. Our data source may be those training attendance sheets, and it's going to be done every 6 months. So you can see the components start to come together. Usually when I include in the timing or frequency of when data should be collected, I tend to be more specific to the actual month when the data collection will be completed to keep me on track. So I need to make sure training collects that training attendance sheets. So many times I've seen that sheet sometimes go missing, and we tried to recreate that attendance sheets, going back to try to find the participants, making sure that you scan those training attendance sheets and those are placed in some place secure by the M&E officer or the program manager. And making sure that, okay, we said we're going to do the training. This is part of one of our objectives, overall objectives. We need to be able to report this in a certain period. Let's work backward in our timeline to make sure we can have that information when we need to report it. Yes. Oh, also one thing that I also look for when I was doing more active evaluation is, even when I go into a project, I always ask, where is your M&E plan? If it's in a drawer, if it's on a shelf somewhere, it's old and it's kind of needs to be dusted off, I know you're not using it for active planning, and that really is important. Everyone should have an understanding of the plan, and it should be visible, so it keeps you on track. The fourth component is to identify, again, those M&E roles and responsibilities. It's important to decide from the early planning stages who's going to be responsible for collecting the data for each indicator. This can be a mix of your monitoring officer, or if you have research staff or your program staff, but everyone needs to work together to make sure that data is collected accurately and in a timely fashion. Data management roles should be decided with input from the team members. But for me, I feel that everyone in a project, every staff person that's hired from the secretary to the director should know what your project is about. They should be able to tell you within 2 sentences what your project is about and where you are. So when you do have, even though they may not directly be responsible or have an M&E role, you never know. You might need that secretary or that admin assistant to help print off certain things. They should know what it's for. Make sure that you really get the buy-in from all of your staff and understanding of where the project is at, and persons can speak about it. You might know from your own experience that it is that admin assistant who may be going about her business and say, hey, I heard you're part of this thing, or you're working for that project or program. What is that about? What are you guys doing? How is it going? They should be able to feel comfortable in explaining what your project or intervention is and where you're at right now. But let me give you also an example as we continue to shift and develop more of this M&E framework to including the roles and responsibilities. So you have your indicator now, you have your data source, you have your timing, and then you have your data manager. Again, it could be helping, that could be the actual staff person or a project manager. It can be a research assistant or a field officer. Putting it into an M&E plan with the indicators really is useful, so people have an understanding ahead of time when you actually have to implement one of those activities or collect data on a particular indicator. The fifth step is what somebody had mentioned before about creating an analysis plan or reporting templates. So once all of that data has been collected, someone will need to be able to compile the information, analyze it to help fill a results table for internal review and external reporting. That M&E plan should include a section with details about what data will be analyzed and how the results will be presented. Even as you go through the process, don't necessarily wait till your end of year to be able to tell your staff, even your data collectors, where you're at. There might be a internal or in-house monitoring evaluation officer or research assistant for the program that can help support the development of this portion of the plan. And as mentioned before, if you have an M&E officer or research staff to help analyze your data or perform any statistical tests, what tests are they? What program or software is needed to help analyze the data? Is it SPSS? Is it Stata? Is it something else? You want to make sure that you either farm out, in my experience, I have to say, either you farm out all the analysis as much as you can to someone else if you don't have the internal resource to do so. So if you have data that looks at differences, say between different groups, or you want to make sure that there is a measured and a statistical understanding of the difference between having your intervention versus not having your intervention, farm it out. It's harder to, if you never originally budgeted for SPSS, unless you're thinking about long-term sustainability or any kind of statistical programs, it's best to maybe farm it out instead of doing it internally. So now because if you do it internally, you say, okay, we can buy a statistical program. There is likely to be a very high road in terms of completely understanding how to use that statistical program or software program to generate any kind of analysis, but also then being able to decide how to do some of the statistical tests. How do you program into those particular softwares? It can be a big learning curve, and that can really hamper your time in terms of being able to report on the analysis. Does anyone, Novia or Elizabeth, want to say anything about related to this area?
No, Shelly, you got it.
Okay. So here again, as we continue to expand this M&E framework, we will also see here now we have the baseline, we have year, we have lifetime of the project, lifetime or overall project target can be broken down by project year, and then the proportion of target achievement. It could be a proportion of achievement or the number that was as you look at your targets. So the number of trainings, say for the first one, number of trainings held with a healthcare provider. So you did 5 in year 1, you said you're going to do 10 overall, and at the end of year 1, you're at 50% achievement. Great. The number of outreach activities conducted at youth-friendly locations, as you can see, year 1, you did 2. Overall, you need 6, but this is a 2-year project. So you might know, okay, we're at 33%. It means that maybe we need to speed up something else. We need to try to get something else done in year 2 and plan that out more carefully. So these tables really should help outline all the information you need, and it is part of the plan. Like I said, you can include the indicator target and how the program has progressed towards that target. Really can help project managers keep track and have a better understanding of where they need to go. Finally, we talk about a plan for dissemination and donor reporting. A lot of times people don't think that this is necessarily included in the M&E plan, but I think it should be. It helps to describe how and to whom data should be disseminated. Collecting data just to collect that data is not the goal. It should also be, data should always be collected for a particular purpose. And consider the following. How will this data be used to inform staff and stakeholders about the success and progress of the program? How will it be used to help staff make modifications and course corrections as necessary? As we saw in the previous slide, that number of community outreach activities, we're only at 33%. We're at the end of year 1. What else do we need to do to make sure we understand what the bottlenecks are in going out to the field? How will the data be used to move the field forward and make program practices more effective? So when you have that plan and you're looking at it, I would say always look at your M&E plan at least monthly. If you don't have it displayed all the time, just to make sure you're also on the right track and that you're able to inform your project director or other stakeholders of any course corrections that need to be made. So if you couldn't do a number of outreach activities at your youth-friendly locations, what's the problem? Talk to your data collectors, talk to your program staff. What can be done? What else is it they're going somewhere else, or is it a problem with maybe accessing the facility? Is it a personal problem maybe with the director? They're not understanding what you really need to do. Maybe they disagree with your type of intervention. That's the time that you really can try to focus on what kind of course corrections that need to be made so you can achieve your overall objective. Any questions here? Elizabeth, anything in the chat?
No, I don't see anything in the chat. I know that this is a lot of information.
Yes.
So it's it's a lot for people to process.
Yes. So I'm gonna go to the next part.
Wait, Shelly, just before you move on, As it regards, if you could just go back to the previous slide, this really connects to how you would have planned your project in the beginning. So in the last session, we would have talked about creating a project plan, and a key part of creating a project plan is also your communication and your stakeholder management. So at the beginning and early in your process, you should already be thinking about who are your key stakeholders, what kind of information will they be interested or will be relevant for them, and then how can your, not just your program activities, but as we see here, your monitoring and evaluation activities, how can those support your continued engagement of those stakeholders? So whether it is that you plan periodic meetings to share findings, or even progress updates, or at the end, you plan to make recommendations about this particular area or subject matter or the success of the intervention, planning upfront at least a sketch of who are your key stakeholders and what they need to know will also help in what activities you monitor, how you monitor them, and what do you actually collect. So that at the end of the day, you're not thinking at the end, okay, well, I'm going to do some monitoring now, who do I want to tell? But it's organically built into the plan for your project, so that at the beginning you're foreseeing, well, these are the impacts that I'm expecting to have with this intervention, or these are the challenges we expect to come across. Who will we need to keep in touch with and engage, and what will we need to engage them? So the planning for this upfront really helps that there is a seamless relationship between what you do, what you monitor, and then what you communicate.
Excellent. Thank you. That's a great point. That's a great point. And really thinking about those communication plans, are making sure that they're in place, like you said, at the beginning of the project, and become routine for project meetings and other kinds of periodic review, so that there's a better chance of being productive, that everyone looks forward into what needs to happen and what changes or bottlenecks that can be addressed. And a lot of times stakeholders, once you give them those kind of updates, if you have a project board, they can be the ones to help address some of those bottlenecks. And in my experience, project progress is usually never shared with all staff, but it's always beneficial that all members from your on your team are able to say where the project is and how it's progressing. Again, and if you look at your dissemination of your printed or digital materials, discuss these also with your stakeholders and your board and your team, to determine the reasonable expectations for data review. So even though you may have said that, okay, I'm going to put something on my Facebook page about something, and then we're going to check the number of likes, or we're going to check how many times people go to there, go and actually review that information that you put in there. Maybe doing it monthly might be too much. Maybe wait till 3 months, but your team should be able to help you understand and have reasonable expectations for when to review that information. I wanted to say something in particular for the challenges for those who, for M&E, especially those who are doing advocacy work. Determining and proving the links between policy influencing activities and policy changes can be very difficult. You can't necessarily know with absolute certainty that your campaign caused a policy change, but you can help to attribute some of the changes to your activities. You can say what factors and what actors help to support that change. In addition, when you're doing an advocacy campaign, getting honest feedback from target groups, like policymakers, might be very difficult, and they definitely might have a different perception of what they think your intervention is supposed to do. They may not agree with it. Maybe you need to have better conversations with your stakeholders to understand how to get that feedback, honest feedback, with the changes that you want to see happening. So let me do an overall overview. So now you've seen the components of a monitoring plan. Look at your model, have a logic model or your theory of change. You're looking at your program goals and objectives first. you develop your indicators, or you select your indicators and start this table with your data sources, your timing or frequency of data collection, and the staff members responsible. Understand and give a description of each staff member's role in data collection, analysis, and reporting. And have a reporting plan. Your analysis plan and reporting templates would really be useful at the beginning. So, excuse me, so that when you're actually ready to create that report or submit a report for a donor, a stakeholder, or a project board, that everything is already there and you already have a template that would help ease how you write the report. Sometimes when you leave reporting at the end, it can be considered just so daunting. But once you have a reporting template, that should help ease your fears a bit, because you actually know exactly where you're going to be reporting and what's required, specifically for donors or other stakeholders. And then you have your dissemination plan. This describes how and when the M&E data will be disseminated. I know I'm concerned about time, so I might just skip the actual this component related to an exercise, but again, look at some of the best practices. And some things I've hopefully that I've stressed during the course of this discussion. Again, reviewing your logic model and theory of change often. Be realistic from the start, what can be achieved and how achievements can be measured. Create a solid and robust monitoring and evaluation plan. Make adjustments when necessary, but usually when you have a monitoring plan and if it's done correctly at the beginning and really thoughtfully, it shouldn't necessarily need a lot of changes. You're not going to change things because you're not getting the information that you want. You might include an indicator, but you still have to focus on what you said you were going to do and what you're going to collect. When you have a good M&E plan, you help to build sustainability into your approach. Again, think about sustainability at the beginning and not the end. If you have an idea of what components could be most successful, include that and talk about it with your stakeholders. Cost your M&E plan. Not having a budget may affect it and make it more difficult for you to measure results successfly. You don't want to necessarily not measure something because you don't have money for it. Figure out if you cost it at the beginning. And again, this also is reflected in your program planning stage or in your project proposal stage. Make sure that money is included for your monitoring activities. Choose a data collection team that has a track record of execution and has a right attitude, and build that trust. Create the dissemination plan early. Like I said, don't wait for the end of the project, and communicate about your project's progress early and often. Keep track of those lessons learned during the implementation, so small bottlenecks, things that have come up. Check your risks and assumptions as well. And did they hold true? At the end of the day, you're going to find out whether or not your risk and assumptions hold true. Sometimes we just have that at the beginning as we develop the grant, but we don't necessarily go back and check it. But this is also part to help you validate your theory of change when you look back at your risks and assumptions. And then again, document indicator definitions, source of baselines, and thinking about the targets. Even it could be part of your M&E framework. I like to put it attached to my framework because if I define an indicator, anything can happen to me tomorrow. So if I haven't selected that indicator from a source, I actually have an understanding of, especially if I have a proportion or percent, how that should be analyzed. So I know exactly where I'm going to be getting the numerator and know exactly where the denominator is coming from. I have an understanding of how this indicator is, how this indicator will be collected, how often, the source of your baselines is very important. So if you know you're not starting at 0, where did you get that baseline information from? And include some thinking around your targets. Okay, so we chose 100% because this way you have everyone on the team, especially your project director, your project manager, and everyone else that's involved in the process, have an understanding around your M&E plan and why you chose certain indicators. Having those things defined really is useful. If anything else, say that person, M&E officer, leaves, or there's a question by a donor or other stakeholder, well, how did you come up with this? What is this supposed to be? Tracking that and putting that information down early really is useful and helps you not get too flustered when being asked those kinds of questions by external bodies. And especially you're thinking around your targets. Targets should be set at one time. They shouldn't necessarily be modified. That's why you're doing it, excuse me, carefully during the beginning of your program planning process. And when you set those targets, just because you think, oh, really, I set it at 80, but maybe it only seems like we're going to be able to do this activity. Maybe we should change the target to 50. Not necessarily a good plan. If you already submitted a project proposal and said your target was going to be 80, get as close to the target as possible. Usually 70 to 75% of achievement of a target is considered pretty good. So have that in mind as well. And back to also when you're developing your targets or selecting your targets, is to be a little bit more conservative. If you definitely know you can get 100 versus 50 persons, I would make your target at 100. If you surpass that target, great. You're able to tell your donor and your stakeholders we surpassed our target. People would rather hear that than, sorry, we were only able to get 50% of the target. And then a lot of the questions come in about why and how and what did you do to adjust the course of the work that you're doing to reach your target. So those are just some best practices and some tips. I just want to open it up again if anyone has any questions or concern, especially maybe even around best practices. How many of this was new information for persons? Thoughts, comments, concerns? Was this useful? I'd like to hear from you. It's a lot of information, yes, I know. What about, I'm surprised nobody has brought up the issue of really of sustainability, putting together a sustainability plan. Have you ever included a sustainability plan? Have you ever developed one? It may or may not be part of a requirement for a project proposal, but it's a good idea to include one as part of your planning process. The sustainability plan really has become more and more important because donors would like to fund projects that have potential to thrive and survive in the long term. And it goes hand in hand really with the evaluation and can be presented as the second part of the evaluation plan. Okay, I've bored everyone and everyone is asleep. So.
Okay, we have comments from Elliot and Tamu in the chat. The information is very useful. I wonder if, Lindell has a hand up. Go ahead, Lindell.
This has been extremely useful. About the question about new stuff, I think I have experienced almost every aspect of what you spoke about. It's just that I have never had it broken down like that for me, because I've always worked with an M&E officer and you follow along with them and you're part of the process. But to see the components broken down like that gives me a lot more confidence in me knowing what I thought I didn't know, if you understand where I'm coming from.
Yes.
This is extremely helpful. I'm really happy that I participated. Even the aspect of the sustainability plan that you just spoke about, I've found in many of my projects, the request for them didn't come in the beginning. It's only sometimes midway that donors sometimes come and say, hey, we need to make sure that this is sustainable. And then it happens. So I think going forward, we need to make sure that it's part of our M&E plan, our communications plan, and we should have a sustainability plan even before they ask for it, because we know it's going to eventually come, because they now want to see that their funds are not being used for a one-off event, but that it can be used, going forward to make life better wherever it is that they're making those funds available for and to. So I'm really very happy though. One question, will that PowerPoint presentation with the recording be shared with participants? Because I think it's a great asset for all of us to be able to refer to or to have access to, especially the notes.
Yes, Linda, to answer your question, we usually send it out in a newsletter after in the week following. So attendees will be able to get a copy of the presentation and recording.
Okay, so absolutely happy that I am here, to be honest with you, and it has been extremely useful. Like I said, not new stuff, but reinforcing some of the things that I knew and I didn't think that I knew, but I am really, really happy that I took time out to be here today. Thank you so much.
Well, I'm glad. Thank you so much. Anyone else want to comment? I know it's a lot, but I think as all of you, I know half of you have had experience in doing this. Hopefully for the other half that haven't been as involved in developing monitoring and evaluation plans, it's a process that can be learned and can be done succinctly. And I wanted to make sure that we make the process as easy as possible. I've also included a resources slide in the presentation that has actual templates for M&E plans or M&E frameworks, thinking about indicators, looking at dissemination plans. So please feel free to go online and check some of those resources out. So you'll have this presentation to see how those components come back together. And let me just go back and just come back to what I showed you at the beginning. Right. So this was the example of that monitoring evaluation framework. And we've spoken to each one of these items: your goal, your outcomes, your outputs, your indicators, its definitions, your baselines and targets, your data source, or also called means of verification, frequency, responsibility, and reporting. This is there are a lot of M&E frameworks or templates that are out there. For me, finding one that actually included all of these components at one glance and one look really can be the most useful type of framework that you use, so that everything is sort of together and everyone has an understanding of what you're trying to measure, where you're trying to go, who's going to be responsible for collecting that information, and most importantly also how it will be reported. Anyone else have any final comments, questions, concerns?
I just had a quick question for you, Shelly. So a lot of us are sort of dealing with public health matters. And so when it comes to monitoring and evaluation, could you speak to a little bit about when ethics approval would be needed when we're doing our evaluation, I guess, depending on the types of questions that we're asking people?
I didn't even really focus much on the evaluation component. I really focused on that monitoring plan. But when you are developing your intervention, usually at that time of your project proposal and you're ready to, before you go into the field or during the time that you, either before you submit a grant, that you go through an ethics review, and it really is dependent on say if you have a health-related intervention or other type of intervention that if you feel that it needs to go through ethics review. There's certain characteristics of projects that tend to require ethics review. Anything dealing with youth or children, they want to ensure that you are taking an ethical approach to your intervention and would cause no harm to the participants. And that's the overall kind of focus when you have an ethics review, that you won't do any harm to your participants. What you ask, how your intervention is being implemented, that it won't have any effect, but hopefully have maybe a positive impact on the participants. We want to make sure you just do no harm, and that how you even do your actual intervention is not going to be disturbing in a very big way. So if you know that you have an intervention that has to deal with maybe more, has to deal with a topic that persons who are more conservative object to, the part of your plan is making sure that, and you do the ethics review and say, okay, we really want to talk about, I'm gonna just use this as an example of HIV and sexual procurement of sexual intervention or prevention activities. So that means if you're going to talk to youth who are 15 or under, or 18 and under, and you really want to show them what condoms look like, what dental dams look like, if you want to talk about anal sex, if you want to talk about different forms of sex, that, you know, when you have an ethics review, they have to be confident that what you're doing is not going to cause any problem, and that you can adjust your intervention so that this is communicated and your intervention isn't necessarily going to interrupt or have a strong reaction necessarily by external stakeholders. Elizabeth or Novia, do you want to make any comments about ethics review? Maybe at the time of your grant development or during project implementation?
Oh,
Yeah, sure. Go ahead,
go
Elizabeth.
ahead, Novi. Oh, I was just going to reiterate what you were saying, Shelly. You might have to, if you have any kind of data collection plans, you might have to present the what the plan is, the actual tools, the questions that you're going to ask. You know, if you have that ready, that would be helpful. And other populations that you might consider vulnerable, any vulnerable populations are women, pregnant women. Those are also populations that are often considered vulnerable, and you know that you should definitely have an ethics review.
Meaning that you've taken necessary precautions to protect that population if they are considered vulnerable. Novia?
Yeah, I was going to say, and if your initial project, of course, includes research as a component, then an ethical review is always recommended. In some countries, it is required once your research is going to be engaging human subjects. Each country may have different requirements and standards around how the ethical review is conducted, and based on the nature of your work, it's usually advisable to at least have some advice where that is concerned early on, so that you don't find that later in the process, you know, you're attempting to collect a particular bit of data or attempting a particular intervention, and then there may be an issue or a challenge. So again, I think what we've been trying to emphasize over the course of these 3 workshops is that the upfront planning and consideration is important for the smoother running of your intervention, right? So as many of these boxes, from the point of view of your grant preparation, your project planning, your M&E planning, if you can make some of these considerations earlier on, even if you don't, completely have all the answers or, check all the boxes up front, at least you would have started thinking about and discussing with these stakeholders some of these matters to make it easier and have fewer surprises as you continue with implementation.
And that's so true. I know, say, for example, I know a lot of projects that get held up at the initial stages, even as they've won the grant, they have to go through an ethics review because they're dealing with human subjects or particular vulnerable groups. And it's always best to know when that ethics review is going to occur. Sometimes those committees meet a few times during the year. And if your submission is not included at least a month prior to the review, you might have to wait 3 to 6 months for you to get an ethics approval. By that time, you've gone into a quarter of the timeline for your implementation of your intervention. So please keep that in mind. I've seen a lot of projects derailed because of that, they failed to get ethics review early or know the timing of when ethics review has to be done, understand the particular forms or what needs to be submitted for that ethics review. Because I've also seen, okay, they didn't insert one of those tools that they were going to use. So the review can't be done until all components of that intervention or tools and everything that needs to be submitted as part of that application. And then they have to wait another 6 months because the ethics review board doesn't meet on time, or they have too many applications and they don't get to yours. So please, yes, this is a really important point, and I'm glad you brought it up. Anyone have any other questions or concerns? Any last questions, thoughts? No? All right, so then I would like to say thank you to everyone who participated today. I hope this was useful. Like I said, I have a list of resources, and if you have any questions, always also feel free. You have, I think Shelly will have my contact information. If you have any further thoughts or concerns related, especially to developing the M&E plan. Thank you very much for your time.
Thank you so much, Shelly, Elizabeth, and Novia, you all for facilitating today. Really appreciate it. It was a lot of information, very useful information. So we want to thank you, and thank you all for attending. So this is actually the third in a 3-part series that we've been hosting for capacity building for our CSOs and organizations and persons working in the NGO space. So we're really glad that you appreciated the information and the content. As I mentioned, we will be following up with the slides and the links for the resources that Shelly mentioned, as well as a recording of this session to all of you who attended. So thank you so much for taking the time. If you want to learn more about Lake Health and Wellbeing, you can visit us, find us on social media, on Instagram and Facebook. I understand some of you found out about this session via Facebook. So find and follow us on social media, as well as our website. It's lakehealthandwellbeing.com, lakehealthandwellbeing.com. So you can also stay abreast and stay tuned for any other events and activities similar to this that we may be hosting in the future. So thank you all so much, and have a good rest of the day and rest of the weekend. Thank you. Bye, everybody.